Painkillers are wiping out male fertility. Everyday medicine, some available over the counter, might not be so good for you or your dudes down under. According to a study by the U.S. National Academy of Sciences, common pain medication negatively impacts male reproductive organs. CNN reports that the research looked at ibuprofen, aspirin, and acetaminophen, better known as paracetamol. These drugs disrupt male hormones. The study looked at 31 healthy Caucasian men between the ages of 18 and 35 and gave one group 2 600 milligram ibuprofen doses per day and the others dummy placebo pills. After a fortnight, men taking the painkiller had their luteinizing hormones linked to testosterone and sperm production, match the ibuprofen in their blood. They also simultaneously saw their rate of testosterone to luteinizing hormones diminish. This created a condition linked to weakened fertility, stroke, and heart attacks known as compensated hypogonadism in the men affected. A researcher told CNN the impact on the men in the study is reversible, but the impact of long-term use is unknown. More medicine stories.
President Trump's hair loss medicine explained. U.S. President Donald Trump's doctor recently told the New York Times that the 70-year-old leader of the free world was taking the drug Propecia. But what exactly is it? Also known as finasteride, Propecia is a commonly used drug that treats hair loss in men, particularly male pattern baldness. This is a sex-linked characteristic inherited from the mother, whereby a bald patch gradually forms on top of the patient's head. Propecia treats this by inhibiting the production of DHT, a form of testosterone linked to baldness. The side effects of the drug reportedly mainly hamper the male libido and can result in decreased sex drive as well as erectile and ejaculation issues. If a patient stops taking the drug, hair loss returns. According to U.S. government information, male pattern baldness does not indicate a medical disorder, but may affect self-esteem or cause anxiety.
Whatever happened to just putting a hat on it? Researchers are working on a contraceptive hormonal gel that reduces sperm count when applied to the skin. The gel contains 2 synthetic hormones, nesterone and testosterone. The nesterone blocks the testes from making enough testosterone to produce normal levels of sperm. The synthetic testosterone is needed to prevent hormonal imbalance caused by the nesterone. Men in the study will take home a bottle of the gel and rub around half a teaspoon of it on their upper arms or shoulders every day. The gel takes about a minute to dry. More than 400 couples in the US, the UK, Italy, Sweden, Chile, and Kenya will participate in the clinical trial.
Scientists are calling this a medical breakthrough. A drug typically used to treat arthritis and fever can cut the risk of heart attacks. According to U.S. government information, heart disease accounts for 1 in 4 American deaths each year. New research suggests that the anti-inflammatory drug canakinumab can reduce the risk of a repeat heart attack by 15%. The research tracked 10,000 heart attack patients in 40 countries who were treated with the drug every 3 months over a period of 4 years. Canakinumab was shown to be more effective than statin, another drug heart disease patients usually take to lower cholesterol. The researchers also found some in the study, most notably the elderly and diabetics, contracted potentially fatal infections and sepsis. Experts say the drug could save lives, but some are wary of the side effects. Are cows the cure for HIV? U.S. government-funded HIV research in cattle may hold promise for future HIV treatments. In a study, scientists injected 4 calves' flanks with HIV. The cattle's own immune system first produced antibodies that nullified 20% of the virus in 42 days and counteracted 96% of the HIV virus within 381 days. Researchers theorize the cattle were able to do this due to their robust digestive system that encounters a variety of bacteria. The research may point to cattle being a source of medicine in the future.